to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks.
Hello, everyone, and welcome to Health for Naija podcast. My name is Dr. Ngozi Onuoha. I'm a primary care physician, and I'm the founder of Health for Naija. I create health content to help bridge knowledge gaps to improve health outcomes for a multicultural audience. So today I have a special guest with me. I want to give a warm welcome to Dr. Oluyemisi Famuyiwa. Welcome.
Thank you so much. Thank you for having me.
So I'm going to tell the audience a little bit about you, what you do. So I'm going to go over your bio. Dr. Oluyemisi Famuyiwa is the founder of Montgomery Fertility Center and Associate Clinical Professor of Obstetrics and Gynecology at George Washington University School of Medicine. Dr. Famuyiwa is an advocate for personalized, holistic fertility care. She has been recognized with numerous awards, including the Castle Connolly Top Doctor Award since 2012, and most recently nominated as one of the women who moved Maryland. She has been recognized by Castle Connolly as one of the exceptional women in medicine every year since 2019. She recently launched the most diverse egg bank, servicing families from all backgrounds. Dr. Famuyiwa is also a staunch advocate for fertility preservation, especially for busy professionals and cancer patients. She has numerous publications in peer-reviewed journals and regularly gives presentations on the topic of fertility treatment. Today, we're very happy to have Dr. Famuyiwa here. I'm going to refer to you as Dr. Yemi.
Absolutely, that's fine.
And today you're going to be talking about fertility for busy professionals.
Yes.
Thank
you so much for that kind introduction. It is my pleasure. I love sharing information. And today I just want to give a little bit of talk about just to give a sense of fertility, especially for professional, busy women, right? Like us, who are very busy, lawyers, doctors, athletes, professionals, actresses. Everybody's busy. Life is good. You're doing multiple things. So I think that fertility typically is defined as, the inability to conceive after trying for about 6 months if you're over 35, and about 1 year if you're over 30, and less than 30. I'm sorry, if you're less than 35. But I always encourage women, whatever age it is, if you're having difficulty getting pregnant, maybe you don't want to wait that many months. You don't want to wait, the whole 6 months. If you're not getting pregnant right away, please seek help. So that's the first thing I'm going to say. Now, how do you seek help? Reach out to your primary care doctor. Someone like Dr. Ngozi is someone to talk to. Doctor, I'm trying to have children. I can't have children. Another conversation I want you to have is, even if you're not trying to get pregnant, but on your vision board, if you were to paint a picture for me, do you see children in that picture? If you do, if you see yourself one day as a mother or grandmother, no matter where you are, even if you're not married, if you're single, you need to start thinking about what you need to do so that you safeguard that vision for the future, right? So if you're 32, you're just, finishing your medical residency, or you're finishing law school, or you got that great acting Nollywood contract, and I mean, come on, life is good, or you're a musician, you just killed it, you just presented before the king. You know what I mean? Take 2 weeks off. 2 weeks. You don't even need to be completely off. Because if you come to a clinic like mine, I like to work with people's schedule. But figure out just 2 weeks of your life so that you can safeguard the rest of your dreams, your future. And what I'm specifically referring to is seek out a doctor who may say, well, why don't we look at freezing your eggs, right?
Okay.
Because you want to make sure that you have eggs left when you get older, correct?
Right,
So that's what I always advise my patients. So that's a good place to start the talk.
So when you say take 2 weeks, what will the woman do during that 2 weeks? Is she having tests? Is
Right.
she
Mhm.
having eggs retrieved? What's going to happen in that 2 week period?
Exactly. So what I mean by the 2 weeks, it doesn't include the initial workup.
Mhm.
The initial workup being that we need to check your hormones. It's usually checked on the second or third day of your menstrual cycle. You don't need to take time to do that. You can just go to the lab in the morning or the evening, you get an order sheet, go get that done. That doesn't take time off, right?
Right,
If you need to get any studies such as an ultrasound or an HSG, you don't need to take 2 weeks off. You can go to radiologist, either get a late appointment or get a weekend appointment. That is done. So you
right,
get your preliminary workup. We want to know how many antral follicles, how many pre-stimulated eggs do you even have in your ovary?
right.
What does your uterus, I call it the plumbing, your tubes and everything, what do they look like? So you can get that preliminary information started without
Mhm.
really taking that much time off. When
Got
I say the 2 weeks
it.
off is when we decide we want to treat or we want to preserve your fertility, and we're going to stimulate you to produce mature eggs that we're going to collect, it takes roughly 10 plus or minus 1 or 2 days, right?
Mhm.
And to collect the eggs and everything. And then you're free. So you don't even need, most of the time I try to work with people so that they can still work while we're even doing that. But closer to, say, something like an egg retrieval or whatever, you might need to take some time off because you're going to get a procedure. But so I digress a little bit. So the question we need to ask is, are we saving your eggs for the future, or are we actively treating you to get pregnant, right? Then some of the workup overlaps. Then it kind of diverges. If you say, okay, I want to get pregnant now, then we're going to need additional evaluation. We want to know, where's the source of sperm? What's your partner evaluation? Has he gone for a semen analysis? Does he have any sperm issues? What's your overall health? What medications are you taking on? What are, any genetic conditions we need to worry about? So we do a complete, I call it sort of investigative Sherlock Holmes detective work. We got to sort out the information first because, like we like to joke around, we are as good as the information we input into us. Garbage in, garbage out. Quality in, quality out. So we need to do that initial evaluation first. Again, if you're freezing your eggs, it's just you. We don't need to worry about anyone else. That evaluation is a lot faster, right? And then we can sit down and talk about treatment. What are the possible treatments? If everything's okay, meaning we didn't really find something obviously wrong, so the tubes are open, the uterus is fine, lots of eggs, sperm's okay, you can try time, then of course with a little medication to stimulate ovulation, right?
Okay.
If that doesn't work, you can try artificial insemination, where we take sperm, wash it, insert it into the uterus, which is close to the fallopian tube. They still have to get in the tube, find the find the egg, fertilize the egg, and then the embryo that results starts migrating to the uterus. It takes 5 days to get there.
Right.
If that doesn't work, or if the tubes are blocked off,
Mhm.
then we got to do in vitro fertilization, where we talk about stimulating the ovaries, collecting the mature eggs under anesthesia, fertilizing it outside the body, and then putting it in the embryo in the uterus. I usually go one step further by recommending that, especially for my patients who are 35 and older, that when we have the egg and we fertilize with the sperm, right, it starts to divide rapidly, forms a zygote, the pre-baby, if you will, and that by day 5 sorts out into what is called the blastocyst, where the part that will be the placenta, is on the outside like a spear, a little hollow ball, and the part that will be the baby is clumped at the bottom of this spear. You can biopsy the part that will be the placenta to get an idea of the genetics of the whole embryo, and then you freeze the embryo while you're waiting for the biopsy to come back, right? So that tells me when it comes back, is this a genetically normal embryo? Because maybe that's why they weren't getting pregnant. Maybe they were fertilizing, but they keep getting embryos that were genetically abnormal that are not compatible with life, right? That either leads to a miscarriage or no implantation or a birth defect. So that answer comes back a little later. Then I can say to the woman, okay, now we have the answers. We know which one's normal, which one's not. Now we can prepare your uterus to put the normal one in. So that increases rapidly your chances of actually getting pregnant, at the first go around, right? Even though there's no guarantee. So a lot of things that we need to look at, a lot of data we need to gather before we start treating, right? Because if you don't gather sufficient data, then you're backtracking if it doesn't work. Oh my gosh, did I check this? Oh goodness, did I check the thyroid? Oh my gosh, is she diabetic? You need to do your homework first. Then the actual treatment becomes a lot easier. Okay.
Thank you for explaining the process. I think to someone who's a layperson, it sounds very intricate and actually very complicated, but it's not. It's a question of going to the fertility doctor, getting the blood tests, and getting the HSG to start, the test, the imaging test to check, make sure the uterus and the tubes and everything is in working order.
Yes.
And then you discuss your options with the doctor. So the process is pretty straightforward, but I think there is stigma attached to infertility.
Yes. Yes. Especially, in I would say cultures like ours, right? A lot of um, African cultures, I find the same actually in Asian cultures because I get patients from all over the world. There's a little bit of stigma attached. You hear all these stories growing up of people who cannot get pregnant. They're called barren, they're called names, they're shamed, they're disgraced, they feel isolated, they feel lonely. And I always encourage those women, first, if you will, reach out to us. We have support groups. We have psychologists that we work with that can help you. I like to hear those stories from such women first, right? Then, depending on what my supporting team recommends, then I say the first thing, then the next thing is to bring their partner in. A lot of times, if I meet with them and then the partner and invite the partner to be on board with us as a team, I always tell them, I emphasize the word team, that we are a team. We're going to work through this together. And most of the time, I'm able to get the partners on board. And if I get the partners on board, the next thing I tell them is, please leave your families out of this, right? Leave your aunts and uncles and grandpa, leave them out of this. Let's work on, you know, our team work, both partners, our facility, we're the team. We don't need anyone else in the team, right? Especially if they're going to confuse issues. And then if that doesn't work, I have patients that I've actually gotten in contact with a psychologist with who helps them, almost like a fertility coach, a health coach, a mental health coach. If people are severely depressed or anxious, they may need a psychiatrist to help them with the depression. It doesn't mean they're crazy. No, no, not at all. It's just giving you coping skills to help you, to strengthen you, so you can see that this is a journey that you can actually undertake. Okay.
Yeah, Dr. Yemi, I like the fact that you mentioned the fertility coach because
Yes.
I didn't know that existed. And I know women who are going through this process, egg retrieval, and trying to go through IVF. It is
Hmm.
very challenging for them mentally.
Right. Hmm. Hmm.
And it's
So
nice to have someone to hold their hand. So I'm glad you
yes,
mentioned that.
yes.
Mhm.
So what we do in our office is we also serve as fertility coaches, because I have staff that if you look at all our patient reviews, they'll keep honing on a certain theme. We like to hold our patients' hands throughout this whole process. And I tell them, you're really not alone, right? You're not disturbing me. Come by, talk to us, right? Send me an email, send me a message. I'll get back to you. My nurses will get back to you. My staff will get back to you. I work with an acupuncturist who's also a very superb coach as well, and she does the nutrition. She even goes as far as she's even gone out with my patients to their African stores or the local stores and say, okay, let's look at the food that you're buying that you like, and then let's see if we can substitute healthier options or even keep the ones you have, right? Because, nobody comes into life with a PhD in nutrition or anything. So there may be things that you really like eating. Maybe those things are not really helping you, or maybe they're hurting you. So, she would literally work you through, okay, let's, substitute this, or yeah, this is good, let's do that. And then she looks at the whole lifestyle of the patient. How much stress are they under? We discourage our patients from taking caffeine, which just makes the stress worse anyway. Um, and what else is going on in their life? She prescribes an acupuncture sort of program. It's not a one-time thing. And I find that our patients, they benefit from this sort of holistic approach. And then I have a counselor, a psychologist who now goes one step further, um, and he will work with both the patient and the partner if they're available, um, and sort of give me feedback. What's going on in their lives that can interfere with treatment? That can, because I can be focused on the medical part, but then my team will look at what else is going on so that we can carve out a particular program for our patients.
So you have a team-based approach.
Yes, I certainly do.
Yes, you have a
Certainly.
team-based approach. So you're addressing every facet, the physical, the emotional, the spiritual,
Yes.
which is very important in this journey.
Yes, it is.
Yeah.
It does take that supportive village, if you will,
Mhm.
to let people know that they're not alone, and that we're here to help them,
Mhm.
and also to give them hope that it's totally doable. They can do this. They just need information, right?
Right. Well,
So
that's
a
why
lot
we're
of
here.
times, yeah, they don't have the right information. They don't know where to turn to. So, and I even tell patients, if you've had other treatments before, put every data point that you've had, package it together so that when I see you, I can digest that information, look at it, give you a second opinion, and then prescribe a way forward. If you're on the right path, I'll be the first to tell you what you're doing is fine. Your doctor's doing, you just need patience, that would work. Stick with it, and sometimes people just need to hear that.
Okay. So, Dr. Yemi, you shared a lot of information. So I want to talk on one point, the
Yes.
cost. Tell me about
Ay,
cost.
ay, 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 ay. Okay, so cost is it's there. It's not always cheap. If you have insurance, kudos to you. You can also reach out to whatever clinic you're working with and see if they have a program. Maybe they have a part. In our case, we have several financial companies that we have partnered with that can give people loans, and then you can say, okay, I want to pay for this over the next 3 years or 5 years, and this is how much comfortable I feel paying. So they work out a program that's tailored to them. And then some of our patients, we actually even started a new program where we have a bundled package where they can buy more than one treatment for a lower price so that if it doesn't work and they need additional treatment, they come out, ahead. So there are different options. People should look into that. And sometimes you can also look into, are there agencies where you are that are giving grants? People always forget to look at that. Apply for grants. It's there, it's like, you know, money sitting on the beach. You're strolling on the beach one day, somebody gave you a bag of money and it's yours free and clear. So apply for grants. They may be helpful.
Okay. So one last question.
Yes.
So what happens when fertility doesn't happen?
Right.
What are the options if
Mhm.
the treatments offered do not work? What are the
Mhm.
treatments for the couple?
Okay,
Or if you
so
have a woman who
mhm,
she wants to have a child on her own and she tries for fertility treatments and they
mhm.
don't work. So what are the options for that woman?
So don't forget third party things. So there are things like donor eggs. Um, I've never met a baby that came out and said, "Oh my gosh, did you have me from a donor egg?" You know what I mean? The babies just care that you love them. So there are things like you can go with third party options if you have, unfortunately, a uterus that cannot sustain a pregnancy. You can look into surrogacy. So now we partner with different clinics, even some of them in Nigeria, where we can provide embryos and they find surrogates for us, and that works for our patients. And last but not the least, the goal is to be a parent. This is Mother's Day. We want to
Mhm,
be a mother, right?
mhm.
So some people, their journey to motherhood may include adoption. There's
Right.
nothing wrong with that.
Mhm,
Maybe there's a baby with your name on that baby's forehead
mhm,
crying
mhm,
for you right now. So
mhm,
please don't eliminate that. And I'm so happy that people are becoming more open. And
mhm,
guess what? I've seen men who are more open to adoption too, because I
mhm,
know someone who had boys. He had boys, right? And he and
mhm,
his wife decided, you know what? We can try again. We'll probably get another boy. They
mhm,
have four. So we want a girl. So they
mhm.
adopted a baby girl, and now you would never know the difference. Their heart is full. Their
Right.
family is complete.
Right.
So don't eliminate. Please open your heart to options. If you open up your heart and let love in, your child will find you.
So this is really good. You shared a lot of information, and it's nice that people have somewhere to go to if they need this information. So how can people find you? Can you share your social media platforms with me?
Absolutely.
Okay.
So go to my website, montgomeryfertilitycenter.com. It's all one word. That gives you a link to all my other sites. You can send us an email at FAQ, frequently asked questions, FAQ MFC, sorry, Montgomery Fertility Center. So FAQ MFC at gmail.com, and we will be happy to send you information.
Okay. So I'm going to put those links in the description of this podcast and video. And I just have one more question. I know
Yes,
this, I'm just throwing this on you. And it is, I always like to ask this my speakers. Can you share one pearl of wisdom with the audience? It can be anything, just one pearl of wisdom.
one pearl of wisdom. This is what I even share with my own children. Live in awe and gratitude. Be grateful, right? Be grateful. You may not have what you want now, but even the fact that you started on the journey, you started seeking information, that's something to be thankful for. Be thankful in your heart because I think it just pours blessings in if you can live from a place of awe and gratitude in each day.
Yes, I think I like that. And I think it's also important to let people know that if they can't have kids, it's also okay.
That's right.
not to worry if they can't have kids or they don't want to adopt. Some people don't want to adopt. So
Right.
that is also
Absolutely.
okay.
Absolutely. It's all about your life journey,
Mhm.
right? Be grateful you're wholesome, healthy, able to breathe, enjoy your environment, and go on a path of self-growth, self-discovery. There's nothing wrong. I always tell my patients, there's no wrong option. You will come into your own option that is comfortable for you.
Thank you, Dr. Yemi, for sharing those
Thank
words
you.
of wisdom. I've certainly enjoyed listening to you and learning. I've learned a lot, and I'm sure that the audience is also going to learn from listening to this video or podcast.
Thank you so much.
Thank you so much. I really appreciate your time.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.